Okay, this is the Arjo Tempo Lift. What this piece of equipment will do, it will bring patients up out of the bed, it will get them out of the floor, it will put them back to bed, it can put them in the chair. You can use this piece of equipment for just about any manipulation of movement that you want to do with the patient. Even if you want to just pull them up in the bed, you use this piece of equipment, you don't have to do that manual lifting. And that's why we got all of these lifts in place, is because we do not want our team members getting hurt, straining their backs. Back, shoulder, neck injuries are some of the top injuries in healthcare. And it comes from lifting and pulling on patients, and we want to prevent that. But it's not the only reason. The main reason is much more comfortable for the patients. The very first time we used this lift, I'll tell you this little true story. There was a patient over on West Wing, and y'all don't, some of you are familiar with West Wing, but some of you may not be, that had had a stroke. And it was just terrible for this patient for us to have to try to get him up manually, because he was flaccid on one side, could not put any weight, didn't have any feelings at all. He was the very first patient that we used the lift on, and he said to us the day we used it, he said, every time you get me up, you bring that blue thing in this room. It's so much more comfortable for our patients. So it's not just our protection, it's better for our patients as well. This is a handheld control. It'll make it go up, it'll make it go down, open the legs. If you have to go between the legs of the bed, it'll open the legs, and you certainly want those legs open when you're moving it out from under the bed, so that it does not tip over. You should have at least 2 people helping with this lift when you use it. We do not want people using it by themselves, because it can tip over, but if it's used properly, it should not. To my knowledge, we've had it happen one time. I can't say whether it's happened any more than that or not, but I know of one time.
Can I ask a question?
Sure.
Where exactly on each unit are these found?
Okay, this is both of these are usually kept, all 3 of our lifts, as a matter of fact, are kept on acute care. And I cannot specifically say whether it's 3100 or 3200, because it can be on either one. So you may find it's an area on 3100 and 3200 that has an area for equipment. And I do know when I went to pick this one up, this one was on 3200, but the battery I had to find was on 3100. So that may be something you have to look at.
Chasing it around.
Yes. The bariatric lift was also on 3200. So.
Okay.
But
Can you show us how that battery goes on, if that's something we would need to do?
Yeah. The battery comes out. It's a button here. You push the button, slips right out, and this fits on the wall where it's charged.
Okay.
And then when you put it back, basically you just put it back in, snap it back in, and you're good to go. Before you take this, like if you were going to go and get it to bring it up here to use it, or if you're going to use it on the floor, one of the things that I would recommend, which is the first thing I did, which is part of the reason I was late, was I checked the battery and it was dead. So then I had to go from one floor to the other, get another battery, put it back in the machine, and get the other one on the charger. So I would always check your battery before you bring it up here, because you don't want to get all the way up here and then find out, oh, I got a dead battery.
Yes.
So you want to make sure that you check that battery before you leave the floor with it. It's a very good piece of equipment. Like I said, it can be used to get patients out of the floor that fall. And we want to make sure that people understand how to do that. It's a lot of different ways that you can maneuver this piece here. It goes, you can turn it this way, you can turn it that way. But when you're getting a patient up, you want this pointed away from the patient. You don't want to have it like this. You want it out like that, okay? Questions?
Do we want to demonstrate?
We do,
Okay.
we do. So what I want somebody to do is to, can we bring this up a little bit? Simply because if you were getting a patient up, you would not want that bed going low. You want to bring the bed up to your waist level, where you're not having to bend over like this to put them on the, lift. Come on, Nick. Come on. Batteries, stuff.
All right, so I'm gonna pretend I'm a patient on the table?
Yep.
Okay.
Alright. Who wants to come over and help me? Laura? As a matter of fact, I'll let y'all do it and I can walk you through it if you want me to. Or do y'all want me to show you first?
You can walk us through it.
Okay. Now this part is the part you want away from the patient. So look at it when you open it and make sure that that black piece is not up against the patient because they can have on a gown and most of the time it's open in the back. All right, so go ahead, Laura, and take that piece and you're gonna turn her toward the wall and you want this piece up around her shoulders.
Miss Walker, we're gonna turn you towards the wall. It's okay, just bear with us.
And we're gonna put this under her head. And you want this to come up around her shoulders where she's gonna cradle in it.
Need to be like
Yep. And go under there.
that, as much as you can.
Pick me up.
All right.
I'll roll you this way.
I'm trying to pretend that I'm not really helping, but it's not easy to not help.
All right, and she is in it perfect for lifting because her head is not completely in the top and her shoulders are up even where they should be, okay? Now, we're gonna take this piece and you come up under here, like this, on each leg, and you hold that piece. Now, if one of y'all wanna get the lift,
You talk crisscross.
no, yeah, don't ever crisscross.
All right, easy. I missed the whole first half. I was doing something.
All right, Ashley, let's let it up some because you don't wanna come across her with it like that. There you go, good job. Now you're gonna push it over here. Now you need to open the legs wide because you need to get the legs on both sides of that, probably.
So CJ, I just
Well,
wanna make
this
sure you
thing-
kind of walk up so you can look at the buttons.
Okay. There you go.
All right, so I think that was one of the original questions. Will this go under our bed, our x-ray table, so we can see it does?
Now, as you're letting it up and down, you gotta remember where your hooks are gonna be. Okay, you got your little bottom hooks down here, your top hooks up there. Now, we don't want you pulling, we don't want you straining, we want you to let this do the work. So you're gonna let it all the way down and just keep an eye on it when it gets close to the patient. There you go, that's good, Ashley, that's good. Now, wait a minute, you're good. You can go ahead and hook yours. Teresa can hook hers. Now, what we want to do is instead of Ashley having to pull and strain, because you can see it doesn't work, okay? If she's pulling on this, she's straining her back, potentially. So what we're going to do, Ashley, is we want to bring this part down. All right, now bring the whole thing down.
Just watch her.
Keep coming. Now, just tilt it back a little bit. Other way. A little bit more.
That's as far as you go.
Okay, now just bring it down some more. Now, you can see, go ahead and hook that. You can go ahead and hook it pretty easily now. Now, what you want to do is you want the person on the other side, as you're lifting it up, you want her to have her hand right here, under that, over there, so that when it comes up, it's gonna contour her body to the lift, okay? So as you come up, Ashley, we don't want you to bring her straight up in that position. We want you to bring her up a little bit. Then as you're doing that, we're gonna bring her forward into kind of a sitting position.
You're gonna feel like you're sliding, your butt's gonna slide right down.
It's gonna contour to the left.
I'm just along for the ride.
Hazel, again, while they're lifting her, what's the weight limit on this?
440 pounds. It's on the tempo and the upper. Okay, not too much, Ashley. That's about all you want to tilt her. So now you want to just bring her up. And what you wanna watch for is when her feet lift off of the table, because you don't wanna drag her feet across the table. 9 times out of 10, they're not gonna have on shoes or socks.
When you go slide.
And you don't wanna drag their skin across the sheet.
That's as far as it goes.
So in here, we could lower our table.
All right, let's,
Do it this fast.
tilt her back. No, the other way. There we go. Tilt her back a little more.
You okay, ma'am?
I'm doing fabulous.
There we go. All right,
Like
so then
right-
this other person now, close the legs on the left, Ashley. There you go, as you bring her out, and see, her feet never slid across that surface. Now, what do we wanna put her on? What are you gonna put, you wanna put her on a chair? You wanna put her on, back on the bed? What do you wanna do?
On a regular chair or wheelchair?
I'd rather have a wheelchair.
I would say wheelchair probably be the best practice.
Those chairs are little. I don't trust y'all.
Questions while she's going to get a wheelchair from y'all?
Y'all wanna, y'all see all the buttons?
This is the up and then open, closes the legs and opens the legs. This
Tilts back. and
will tilt it back
forward.
and this will tilt it forward.
And you may wanna tilt her
Back
back.
a little bit.
Until she says.
Ashley's like, this is payback.
Roller coaster.
So now what we're gonna do is we're gonna put, there's 2 ways you can do this. You can turn her like this and go straight into the wheelchair, or you could do, the other way, where you're pushing her into the wheelchair. But this is probably the best way because you got wheels on this chair. So what we wanna do, Ashley, is, what I would suggest, Laura, is to bring the wheelchair back out.
Okay.
Open those legs and put the wheelchair between. That way you don't have to worry about it getting hung up. And we're gonna bring it this way a little bit, Ashley. There we go. Now, open your legs up a little bit more. There we go. Now bring your wheelchair right in between there. There we go. Now, whoever's helping Ashley, they should be right here. Somebody should be behind this wheelchair and guiding this as she's coming down.
Bring her forward.
But you're gonna have to bring her forward, because you do not wanna have to lift her up in the chair, but not all the way. Bring her down first, bring her down.
Bring her down?
Mhm. We wanna bring her almost to the bottom before you set her straight up. Because that way, she's gonna be sitting straight up in the chair, and you're not gonna have to get behind her and pull her up. All right, now, bring her forward. And you can push forward with the chair, Laura, all right. Wait a minute, Ashley, we gotta bring her up a little bit, because we gotta get this chair a little bit closer.
I think the feet of the chair is close as it's gonna let you get.
And push on her legs like that.
All
Okay?
right.
Now, bring her down. Because her butt should be right at the back of that chair when she comes down.
So ahead of time, if we had taken the legs off the chair, that would have given us a little more room to get
Absolutely.
closer.
Now, let it up so she can get out with her.
Wait before she gets out.
Don't move, ma'am.
And you can lean back.
I can't move.
Now, there's a couple of things we can think about here. If she's gonna be sitting here for very long, like if she's on the floor and she's gonna be sitting here very long, somebody should be in the front. Pull it back, Ashley. Somebody should get in the front of her, right there. Bring her forward because she can't control herself. Feel these things right here? They are hard. They're not good on somebody's back. You need to take these out if you're gonna leave her in the chair for any length of time until you get ready to put her back. And then you can put her back in, because these are not good on the skin as you leave them in the chair. And then, of course, take her on the x-ray or take her back to the room, or whatever.
So the blue things, they are reusable, but only for one patient?
That is correct. They are reusable for the length of the stay that they're here. But again, they They could be central lined, but we don't.
Okay.
We use them only for one patient.
So where are the blue things at?
They're gonna be on the floor.
Oh,
So we're just thinking if we had an outpatient that came and they didn't, we weren't on the floor and we don't have the blue things, we could obtain one from the floor, materials management.
Management has them, but, my recommendation, Wendy, is to have one over here,
Okay, we can
Yeah.
order and have a
Bad,
couple.
You mean?
one of these.
We'll get a few to keep in the storeroom. I know it's rare. And team, I know it takes longer to do this, but this is safer for you and the patient in those particular cases.
It is, very much so.
Should we, trade out some people, and I don't know if Wendy, if you wanna video this, but should we trade out some people and do from my chair, because this is often how our outpatients do present to us, in their chair and they need to get over there.
Okay, if you'll stand up, Kim, I'm gonna show y'all a trick on that, because you're right, Kim, and that was my next thing. I'm gonna show you how to put this under this patient when they come to you, out of their car, in their wheelchair. And you need to get them out of the wheelchair without lifting them, but you can get that lift, you can get one of these, and you can actually take that person out of the chair without ever lifting them. So Kim, if you wanna sit back down. And this is how you actually, get her out of the chair using a lift without lifting, or her standing. So you gotta have one person in front. You go up front, stand in front of her, Teresa. You come down here, put it in the chair just like this. And you wanna watch this piece to make sure that it contours to her body. All right, now, come back. Now, you wanna make sure that you have this as much unwrinkled as possible.
I think I've kicked one of y'all's on.
There we go. Okay. All right, now, Ashley, if you bring the lift. And Kim, we're not gonna let you fall. It may feel like it, but we promise.
I trust you.
We're not gonna let you fall.
Do you want to take those things and turn them out of the way?
Yeah, turn them on the outside, which is what you would do if it's a real person anyway. There we go. Now, one thing that you want to make sure of is those wheels on that wheelchair locked. And watch her head since she's sitting. The first thing we're gonna do is move this a little bit more even instead of straight down. Okay, now let it down, Ashley. And after this one, we're gonna let somebody else do it and just us watch. Keep coming. All right, slide back a little bit, Ashley, with the machine. All right, that's good. Now, what I want you to do is bring it down some more. Now bring it forward, yep. A little bit more. All right, now, what I want you to do is I want you to come straight up with her for start.
She's locked in that side.
Just don't go all the way up, just come on up off the seat with her. Okay, now
Yeah, it's
stop.
just like my butt's
Now
not
let's
really
pull
in
the
there,
chair
but-
away from under her. Bring her up a little bit more, Ashley. There we go. Now. Okay, now. We are going to turn her around a little bit. We're gonna have to turn it the other way because we're on the wrong side of the bed, but go ahead and let her up. And see that she's in a lying, kind of a, not a straight up position or not a lying position. Simply because that's the way you want her, for her body to contour to that lift, or that, lift seat before you get her up out of the chair. Because if you try to pick her up straight, her bottom's gonna fall right through the hole. But now, because we've got it where it's going to contour to her body, it's not going to, be half as dangerous for her. Huh? Half. That's right, half. Or as dangerous, let's put it that way. No, that's good. We're all good. And you're right, and see, Ashley has got her head up on that table where it needs to be. You don't want her down here where you gotta slide her back up when she gets there. So whether it's in a bed on the floor, or whether it's up here, you want to make sure this puts them in the spot you want them in, okay?